Good afternoon. Welcome to everyone joining us. So we're very pleased to be launching this webinar series, which we're calling Inside the Index. And this webinar is a new initiative that we've introduced partly in response to the report that we'll be hearing about today. So we're really keen to use these webinars as an opportunity to engage with everyone who is interested in our work. With that in mind, let me introduce myself. My name is Alex Parker, and I am the Communications and Advocacy Manager at Global Health 50/50. And we would love it if you could introduce yourselves in the chat with your name, your organization, and the country that you're joining us from. We'd really like to hear from you and know a bit more about who's in the room. So to start, when we reviewed the evidence from our from 2018 to 2022 of our annual global reporting on the level of gender responsiveness of organizations active in global health, we were concerned that the data showed gaps between the policies of organizations to advance gender equality and health equity and their practices. With this in mind, we commissioned Gender at Work to engage with organizations active in global health on the usefulness of the GH 50/50 research to inform and incite increased actions on gender equality, diversity, and inclusion. In addition, Gender at Work was tasked with exploring the potential of integrating an organizational culture dimension and proxy indicator to capture more accurately the gaps between policy and practice. Gender at Work have produced a comprehensive and rich report on the findings from the study. We are so fortunate that they have taken the time today to share with us a summary of their report. Before I introduce them, I'd like to give a quick overview of the program for today's webinar. Gender at Work will present their findings to us for 20 minutes, after which Sonia Tanaka, GH 50/50's Deputy Director, will share in 10 minutes how Global Health 50/50 is responding to the recommendations from the report. And following that, we'll have about 25 minutes to hear comments and field questions from you, the audience. So please feel free to pop any questions or comments you have in the Q&A or the chat box as we hear from today's speakers. So I'd quickly like to introduce Carol Miller and Kate Waller from Gender at Work. Carol is a longtime gender equality activist, researcher, and evaluator. Currently an associate of Gender at Work, she served as co-executive director from 2019 to 2021, and prior to that worked as Gender at Work's knowledge strategist. She is co-author with other Gender at Work associates of Gender at Work, Theory and Practice for 21st Century Organizations. Marie Catherine, known as Kate Waller, has a PhD in medical anthropology on gender, HIV, and development in Southern Africa, and 15 years of applied research, technical advising, and gender and human rights capacity building experience with government, NGOs, donors, research institutions, and UN agencies, including IDRC, CARE International, Global Affairs Canada, USAID, UNICEF, and the Global Fund to Fight Malaria, TB, and AIDS. Her recent work with Gender at Work supports IDRC staff and grantees to improve gender and intersectionality integration into AI health research for social good. So thank you very much to Carol and Kate. I'll hand over to you now.
Thank you very much. It's a pleasure to be sharing the findings of this report. And I hope you can all see the screen, my screen. So as Alex Parker explained, Gender at Work has partnered with Global Health 50/50 to support them in doing some consulting with organizations active in global health that are surveyed by the Gender and Health Index. And part of this, just to give some background, is because, as we all know, there's been seismic shifts going on, particularly in the last 5 years with the Black Lives Matter, LGBTQI movement, feminist movement. There's also the rise of right-wing forces, which has really brought out among organizations active in global health the importance of addressing gender equality, diversity, and inclusion. And as Alex also mentioned, their Global Health 50/50 is very committed to ensuring that the index is relevant to organizations active in global health. And so as in the last 5 years, for instance, it's very interesting, the variables and the domains have shifted according to being responsive to the context. And a good example is 5 years ago, it was focused just on gender equality for health equity, and now it's focused on, now there's some dimensions around equity, diversity, and inclusion. But there is this questioning about, is the index, what is going on if those measures are saying, you know, those are the measures that are from the index are being used, but yet still there are these persistent gaps, particularly, for instance, at leadership levels. And we really saw that in the 2022 index with measuring board members, that so few were from low-income countries. So with that, Global Health 50/50 hired, we came into partnership for this small research project to really look at the inside in and consult with a small sample of organizations active in global health, mainly leads in human resources or GDI, or leaders of a select number of organizations, to consult around the relevance of the current index to, is it catalyzing actions among organizations in GDI, and to explore the potential of shifting some of the measures and variables, and seeing if organizations active in global health might be interested in shifting how they participate and engage in the data collection and scoring. And finally, there was this inquiry into, would organizational culture maybe be a dimension that might be worth integrating. So this study was really about insights. So the report is divided into 4 sections that kind of reflect what I just mentioned. The first section is learning from organizations active in global health in terms of how are they supporting the advancement of gender equality, diversity, and inclusion in the workplace. And from that, the question is, well, can we learn from that? What are the insights for that to understand the gap between policy and practice? Then the section 2 looks at from the perspective of the the staff from organizations active in global health. What are their perspectives? Has it influenced actions both in terms of informing, but also catalyzing concrete actions? So that's the second section. The third section is then building the case, building on section 1 and 2 and what organizations active in global health were saying to build the case. Does it make sense to look into adding a measure? And finally, the last section proposes possible options for how to, are there ways to measure organizational culture that are in line with the current Gender and Health Index, the way that works, or how could there be certain adaptations? So just keeping in mind that this was a small study, and so it was it was a mixed method study. There was an online survey. All 200 organizations that are part of the regular annual sampling were invited by Global Health 50/50 to do an online survey. There was a response rate of 53 organizations, and the breakdown of the sectors is very similar to the representation of the different sectors in the actual sample of 201 organizations. The other thing, there was also key informant interviews with 10 informants from a sample of organizations active in global health, and then finally the desk review. So just keeping up with time, the findings are, so for the learning from current around current practices in gender equality, diversity, and inclusion, there were some really key themes that emerged from the survey and the key informant interviews. And so I'll just briefly highlight them. And this really helps to understand the gaps between, measurement from the outside and what's happening inside organizations. So it was found that organizations that were building a common and coherent vision and understanding of GDI, that was important. That is, that people in the organization understand the concepts and the vision. That requires inclusive leadership, where the leaders, no matter what their background is, that they're giving space, power to women and people that other individuals and groups that might be typically underrepresented and marginalized. You need inclusive hiring. I think a lot of you probably know a lot of these things. So this is kind of affirming the importance of this mix of multiple strategies. Obviously, training can be important. Internal networks and affinity groups was really important. Deep conversations, creating safe spaces, and also connecting staff with, if you're promoting women's leadership in an organization or diversity, that you need to also connect with initiatives outside of the organization. So from that, section 2 is really the voices capturing what was heard from the organizations active in global health. And there was a real appreciation for the annual reports as really influencing actions. Common thing was policies, and even initiating a gender responsive program or project, and real efforts. The 2022 results, even of the board members, really catalyzed a lot of organizations to take on women's leadership promotion of women from low income countries. And that's just a quote here from someone that said, if we hadn't seen the index, we probably wouldn't have made the actions that we took. Now, in terms of the feedback, there is a real appreciation. One interesting finding was that organizations generally felt like, in terms of internal workplace, that there was a lot of actions around gender equity, but less around diversity and inclusion. And the feedback suggests that equity, diversity, inclusion may still be emergent concepts for a lot of organizations. So it's not that it's not important, it is important, but so that might be, that's already an indication, an insight that for Global Health 50/50, that there might be, that the work on equity, diversity, and inclusion is very important. And just again, to say that there was a really strong appreciation for the variables. There were a few from the Gender and Health Index of Global Health 50/50. There was a bit less appreciation, but very minor, on the variables of sex disaggregation in monitoring and evaluation, workplace policies on gender equality, and gender pay gaps. And the main reason for that is because a lot of global organizations have offices in different countries, right? They're regional offices that might be different from Europe and North America. And so those different operating environments make it challenging. This is just, again, affirming the results, which I've already said, is that the feedback survey, we did from the feedback survey, the 53 felt that the validation process that is used is very manageable and straightforward. Some wanted it to be every second year rather than every year. Some appreciated the every year. And And again, as said, a lot of organizations said that it had helped them take actions. So in terms of recommendations, the organizations, what they did say is they thought that there were some really important things that could be done. For instance, sharing the results with employees within organizations, maybe in a workshop format to help organizations digest and understand what their assessment, what the Global Health Index assessment, individual organization assessment results, what does it mean and what are some of the good practices? And some organizations were open to sharing some internal documentation that might reflect a bit more the organizational culture. Over to you, Carol.
Hello, everyone. It's a real pleasure to be here today. I'm picking up from Kate and looking at the third and fourth. And just want to remind you again that the report itself, the full report, is available on Global Health 50/50's website. So the third section of the report is really about drawing on current evidence plus the feedback from the organizations active in global health on building a case for an organizational culture measure in the Gender and Health Index. And one of the things that Kate referred to is this tension between having formal policies and ensuring that the formal policies are in place, which is one thing that the Global Health Index does pay attention to and scores or assesses organizations on. How do we understand the relationship between the formal policies being in place and the implementation of those policies? And the case is made in the report on the organizational culture as being a sort of key measure or key factor, let's call it that, a key factor for creating the right environment for the formal policies to be fully implemented. And as we see here, we've really talked about organizational culture as being integral to the effective institutionalization of these formal policies. And where there's a conflict between the culture and the ambitions of these policies, it's really hard for GDI goals to be achieved. And we see one, for example, one quote here, I'll just let you read it from one of the key informants. And I think it just speaks to the importance of understanding organizational culture as a context-specific concept and needing to really understand the organizational culture that is operating in the context of the location and space of any organization active in global health. And Kate did refer to that earlier. And just for those of you who aren't familiar with the Global Health 50/50 Gender and Health Index, there are currently 4 domains and 10 core variables. So one of the things we were looking at in this study is trying to figure out whether it would make sense to add an additional variable or domain around organizational culture measures. So I'll come back to that in a moment. Kate, would you mind moving to the next slide, please? Thanks. So what we discovered in the key informant interviews and the survey is that organizations active in global health are already, many of them are already measuring organizational culture in some way. And the list here indicates the typical ways in which they're currently measuring organizational culture. And many of you will be familiar with organizations that use dashboards on staff diversity and gender balance. Of course, this depends on what's available in terms of the kind of diversity data that staff members are comfortable sharing, and that may depend on the context in which they're located. We know they're using pulse surveys, staff engagement surveys, other types of surveys, but I'll just pause for a moment and talk about the accreditation program. So there are a number of organizations active in global health who are signed up to accreditation programs where the organization actually gets a ranking and a certification on their performance on a global on gender diversity and inclusion. And you'll probably be familiar with some of these accreditation programs, especially I see a number of you are from research institutions and universities, and many of you should be familiar then with the Swan Athena Charter, which is one of the most common accreditation programs used by higher education institutions. The others, and in fact, some of the organizations active in global health are already certified through EDGE, which is another popular accreditation program. Over the last few years, there's been a huge growth in these kinds of programs. So McKinsey, Gallup have developed their own accreditation programs that are mainly used in the US context. Kate, please move on to the next slide. So in terms of interest amongst the organizations active in global health who participated in this research, almost 2/3 currently measure organizational culture in the ways that we've just described. And over 1/3 reported their willingness to share anonymized data that measures organizational culture for the purposes of Global Health 50/50's annual reports. So that was quite a significant finding that there is, they're already doing it, many of them who participated in the survey, and they're willing to share that data. So that gave us a bit of an impetus to think about what this might look like in the context of adding something to the current index. And we also canvassed feedback on what measures could be used. And there was a bit of a mix between qualitative and quantitative measures and indicators. And there's a list here of the kinds of things that were mentioned. I'll just pick out a few. One is evidence of public engagement on GDI. So if the organization is profiling its work and being active in social media conversations about GDI as a sort of measure of commitment and commitment to engaging and shifting the environment around organizational culture. Evidence of public reporting on staff surveys related to organizational culture, and more qualitatively interested in measures that help to highlight voice. And just on this note, it's important to, as a reminder, one of the key findings of the external research on what organizations are currently doing around measuring organizational culture and culture change, the idea of belonging, measuring belonging is one of the key areas that these indices use. So just to pick up and lift that point about measuring voice. And capturing the stories. Okay, and then on challenges, those interviewed also described some of the challenges related to measuring organizational culture. This related to issues of confidentiality, privacy of data, some of the methodological challenges because of the different contexts in which organizations work and operate. And then they also mentioned the limits of the current methodology of the Gender and Health Index as relevant to measuring organizational culture. And the point here is really about the current approach is mainly looking at publicly available information. And really these, trying to get at organizational culture would take a deeper dive into the institutions themselves. Okay, so just overall, the key takeaways from the report's different sections. The first is really about understanding workplace culture as demonstrating, or the key sort of value of an organization walking the talk on its formal policies in ways that Kate has described. And the other key takeaway is that workplace cultures vary by context. And this is really important, both for the overall measure, the overall gender and health measure that the Global Health 50/50 undertakes, but also in relation to organizational culture and trying to sort of pay attention to organizational culture change in different contexts. Section 2 really lifted and really celebrated the Global Health 50/50 reports and index as a catalyst for action among organizations active in global health, and it's really appreciated by the surveyed organizations. But there is still this concern that only using publicly available data risks misrepresenting organizations for the reasons that Kate described. And then finally, as I've just described, for section 3, we know that organizational culture is dependent on the context, and so we need to be aware that there's no one size fits all approach to measuring organizational culture. We know that those organizations surveyed see the value of the new measure and are already using some what are considered to be good practice globally around how you measure progress in terms of organizational culture change. So lots to draw on for Global Health 50/50. But of course, measuring it needs to take account of the different capacities and resources and contexts. Yeah. So finally, just the report itself, and again, I invite you to dig in more deeply to the report because we're just going to cover these very quickly. The report makes 4 recommendations to Global Health 50/50. The first is, I'm aware my time is up. The first is to include a measure on organizational culture, and the options are laid out in the report, but it really is to include another domain with 2 more core variables. And again, you can dig in more deeply into the report for this. Then in terms of recommendation 2, we've really looked at what we heard and fed that back to Global Health 50/50 in terms of interest among organizations active in global health for more resources on organizational culture and how to support them in their organizations to move to shift the needle, as it were, on the work around organizational culture change in their organizations. The third recommendation is to revisit the current core variables to ensure that there's greater alignment with GDI, because as Kate mentioned at the beginning, these are largely, when it was first designed, it was largely speaking to gender, and now over the years it's become more inclusive of gender diversity inclusion, but that's not across the board. And then finally, we recommend a more full-going or a fuller external evaluation of Global Health 50/50, because we found in our research, a huge appreciation of the work that Global Health 50/50 is doing, and it could be deepened through a more formal evaluation. So I'm just going to pick up on one theme, and then I'll hand it over to Alex. The recommendations that were made by the organizations active in global health around developing resources for them picked up on 3 themes. One is really about developing a suite of resources on organizational culture as part of the how-to series. The second is a call to Global Health 50/50 to organize more structured learning opportunities on organizational culture change. And then finally, there was an interest in Global Health 50/50 supporting and promoting within organizations active in global health the use of the Global Health 50/50 self-assessment tool for organizations themselves. I mean, right now it's an external sort of benchmarking approach, and tool, but there was a huge interest among those we interviewed of actually supporting organizations to really embed that and build ownership within the organization for using that tool to help them support their own internal journeys for organizational and gender diversity and inclusion improvement. So I'll hand it over to you, Alex, and apologies for going a bit over time. Thanks.
Great, thank you very much, Carol and Kate. And you've done a great job of condensing a very comprehensive report into a great summary there. So thank you very much for that. I'm going to hand over to our Deputy Director, Sonia Tanaka, who's going to take us through how GH5050 is responding to findings from the report. And just a reminder that to pop your questions and comments in the chat. Thanks, Sonia.
Thanks, Alex. Is my screen visible? I don't see it on mine anymore.
It says you have started sharing.
But you don't see anything.
To try again.
Okay. Apologies. Does that work?
That works. Yes.
Great. Okay. Okay, fantastic. So hi everyone. Thank you, Kate and Carol. I think what we've heard from, just that brief presentation is what an incredibly enriching report you've delivered for Global Health 5050. And one of my main takeaways from that report is just the huge amount of activity and trialing, researching, learning, and progress that's being made by organizations right now on advancing the gender equity, diversity, inclusion agendas, and in particular in understanding and shaping organizational culture. I also want to extend our appreciation kind of on behalf of Global Health 5050 to the individuals and the organizations who opted into this review, who took the time to share their perceptions and experiences with us. The issues that we explore and that we monitor in our report and in our index are incredibly dynamic. They're ever changing and sometimes quite quickly changing. And so that really requires that our tool is responsive, that it's flexible. And it really relies on us having the opportunity to engage quite continuously with organizations and with individuals who care about these issues, who care about gender equality and health equity. And so this review has really been integral to the work that we do. This is the first survey of feedback from organizations that we've conducted, and it's provided some very actionable insights for GH5050 to take forward, as we've just heard from Carol and Kate. I guess another takeaway that I drew was that the feedback reiterated that the report and the index are not only an accountability mechanism, they very much are. They also play that role, but they increasingly provide a space, a platform to share information, to share resources, tools, and guidance, and drive action, and I think incentivize change, particularly through exposure to what other organizations and leaders are doing in this space. So we've collected the recommendations and tried to kind of conceptualize these under our own theory of change at GH5050. And these are the three, oh, you can see that part, but our three key areas of work being research and data collection, community and engagement, and driving change and impact. And what we heard was that there are three kind of key questions that we're trying to respond to that have arisen from this review. And that includes, one, how can organizational culture be better integrated into the index? Two, how can we do better to share information and resources, communication, and support to organizations? And three, how do we continue to strengthen our advocacy work? How do we strengthen the role that we are hoping to play as a bridge between the data and change, that meaningful change in organizations? So we've collected some of the feedback here. that we felt was, I mean, some of the recommendations we've been able to address in our existing core variables. These are a set of recommendations that came through where we see these are quite actionable. We've got some near-term solutions to respond to these. And these include questions around whether we can track evidence of these internal networks and affinity groups. As we've heard, these affinity groups are really, it can be quite effective in driving an inclusive environment where people feel valued, included, heard. There's some space for enhanced visibility. There's some power in kind of the collective action and bringing interests and requests to senior leadership in hopes of policy change or change in practice. So we're interested in tracking the existence of these groups. In response to one recommendation, there's the other recommendation we heard quite a bit about in terms of whether organizations are conducting staff surveys. And staff surveys on kind of well-being, sense of belonging, sense of personal and professional development inside of an organization. So we're interested in collecting whether those surveys are being conducted and whether there's any evidence that organizations are taking the further step of reporting on those results and or reporting a management response to those results. The third recommendation that came through was the tracking definitions of equity, diversity, and inclusion. And we do track definitions of gender, and there's kind of a global norm around what gender means, and we rely on that definition and that norm to then to monitor and assess what we find in organizations' policies. Those similar definitions that have kind of a global precedent aren't quite in place for terms like EDI, equity, diversity, and inclusion. And given that these terms mean something very different, even to the organizations in our sample, depending on what sector they operate in, depending on what country they operate in, and also depending on where they're kind of their starting point and what their ambitions are, where they are on this journey. So we are going to track those definitions and share them for the purposes of information to gain an understanding of where where the discourse is right now around these terms. We're also integrating. We've talked a bit about the kind of the limitations that we face as an independent accountability mechanism, which it's kind of two sides of the same coin, that there are some benefits certainly to being independent. We gather the majority of our information from public sources that we see as an integral part of accountability, the practice of transparency. It also allows us to kind of ensure somewhat of a fair playing field, that we are drawing information from the same sources, the same type of sources, and not kind of unfairly advantaging organizations that engage more deeply with us. But of course, what it doesn't allow us to do is to dig deeper into internal documents. And we know that internal policies, especially when it comes to workplace policies, are usually internal. So this year, we're going to be integrating a self-reporting aspect of the index, and that's the first time that we'll have done that. And that's particularly on this question of the staff survey. So we're going to be inviting organizations to share some kind of evidence of whether they conduct staff surveys, what their management responses look like to those surveys. As well as what kind of reporting on the findings of those surveys is shared or not shared with staff. So just a quick recap, and I realize this takes us a little bit away from the review that we're discussing, but I assume that there's some interest in what the research framework looks like this year. I don't think I can move this bar, but hopefully that's not showing up on your screens. have here 1, 2, 3, and 4 are our core variables. So we revisit those variables every year. And and so going back to 2018, the majority of these variables, there will be data against them, and we will continue to report on them in 2023. What we're adding here in the middle, you'll see kind of the expansion of the variables on diversity and inclusion policies, with the addition of a tracking of definitions, the presence of affinity groups, and whether staff surveys are conducted. What we return to every 2 years, kind of below number 2 there, is a deeper dive into workplace policies. And there we're looking at sexual harassment policies, parental leave, and support to new parents, flexible working, and the gender pay gap. And we are, and so we'll return to those this year. We reported them on 2021. We'll return to them this year. We're also bringing in a kind of a thematic focus on the availability of policies and support in the workplace for staff to exercise their reproductive health and rights through a number of variables. And we're having a webinar next Friday that will dig deeper into this framework. So coming back to the recommendations that we are actioning as far as kind of near term for this report. The recommendation to share and publicize more of our resources, including the self-assessment tool, where we've responded to that, or in the course of responding to it, we've updated our resources page on our website, collating kind of everything that we produce into a single space that will make it much easier to access our reports, our how-to guides, some of the case studies that are ongoing, and a number of briefs, as well as the self-assessment tool, which we are also in the course of updating. So we also heard from organizations that they are interested in more opportunities to engage with GH 5050 on the global report, and that's why we are all gathered here as one kind of one action that we've implemented, that we've instituted this inside the index webinar series to provide just that opportunity for organizations with questions, concerns, suggestions to come and meet us. Driving change and impact. So this is the third response area, very much closely integrated with the previous one on communication. So kind of taking that work forward, we heard that organizations want more case studies. They want kind of more real world examples of how organizations are making these changes inside of in their workplaces. Why are they being scored as high performers or fast risers? And so we've got a number of case studies that are underway, and our objective there is really to demonstrate what kind of steps are happening internally based on the findings of the recommendation or findings of the report. Who's involved, kind of where decisions are being made, and what actions and communications are being taken to respond to our findings and improve the performance in the report the following year. We've heard that organizations are interested in more guidance on GDI, and here we're also working on updating our how-to guides. This, I think, is more of a medium-term action that GH 5050 is exploring in our new strategy that I'll show you very quickly at the end, wrapping up, that we are hoping to increase our capacity to engage in a much more kind of active support role to organizations, to be able to provide more tailored support to organizations that are hoping to kind of accelerate their progress on some of these issues. And we'll also be working with organizations to communicate their results to staff through some a kind of a toolkit when the report is published.
Sonia, could you wrap up quite quickly? I just want to make sure we've got.
Yeah, absolutely. So I think we've gone through what the challenges are. It's primarily our methods and where we sit as an independent organization, as well as our current capacity, and that we're exploring how to expand the capacity to provide more tailored support, as I said. But very happy to come back to some of this in the Q&A. Our quick theory of change, this just to indicate that the recommendations that have come through this review are being implemented for the 23 report. They're also being integrated in our strategy that we're developing, and thus are going to be informing our work well past the 23 report and well into the future. So I can stop there. We've gone over this. I encourage you to visit the website to see the new elements that we've added, and very much looking forward to responding to questions. And thank you.
Great, thanks so much, Sonia. Sorry to rush you at the end there. Great, so we've had some questions in the chat, but really now is an opportunity. We've got 13 minutes to hear from our audience. If you have any questions, you can pop them in the chat, or if you'd like to raise your hand, we can also then unmute you and you can ask your question in person. I'm just going to ask our other panelists if you want to put your video back on, and we can try and make it for an engaging conversation. And also just to let everyone know that our co-director, Professor Sarah Hawkes, is also with us. So if there's any question that she wants to jump in on, there's that. So we've got a question from Jean Sebastian. And the question is, I understand there is a gap between policies and practices, but did you find organizations that have good practices without particular policies for gender equities? And I guess, Kate or Carol, if you want to field that one.
I can jump in. Yes, we did. There were organizations, first of all, obviously, that we would only get that information from the key informant interviews. And the key informant interviews were limited, but from that sample, there were some, a few, but a policy can mean different things, right? I mean, it can be, there's many different policies. Some might have an action plan, but not a gender policy per se. But we did see yes, we did. But most had, in terms of the impact of the Global Health 50/50 index on the organizations, the making a policy and making it public, that was really something that was very common.
Great, thank you. We have another question from Catherine. Do you have any initial guidance on key topics staff surveys should include? I guess that's for the gender.
Maybe I could respond to that. In fact, if you look at the report, it does provide a couple of examples of surveys that some organizations active in global health are already using. There's also some links to other resources. But yes, many of the current surveys do look at issues of well-being, belonging, how do I feel valued? Do I feel respected in the organization? But I'd invite you to take a look at the report because there are some examples there and also links to other resources. Hope that answers your question.
Thanks, Carol. We have another question from MJW. I am increasingly concerned with sexual orientation laws, especially when it comes to STDs, HIV, Mpox, as neglect of science hinders proper public health response. This is deadly serious. When you think about definition of gender, is there any way to make room for alternative inclusive concepts? Sonia, do you want to maybe start with our approach to gender in the report?
Yeah, I think it's an interesting question, and I'd be curious to hear what you mean by alternative inclusive concepts. But we draw the definition that we use as our basis from kind of established global norms. So we're not necessarily in the business of renegotiating what the definition of gender is, although there are a lot of efforts to various efforts, collaborative, collective efforts to do that. So I know Sarah spent a big part of her career in those conversations. So in terms of one thing that we do look at in the report, though, is whether organizations, when they define gender, if they are going beyond a binary understanding of gender, kind of male, female, binary. And so we look to see whether there is kind of a more inclusive understanding of what gender means, both in terms of gender identity, but also in terms of gender as a kind of a power and relational concept that affects most aspects of life and health. So I don't know if that answers your question, but I'd love to hear more.
Okay, there's been a follow-up, and the person's name is Matthias. He's said inclusive and legal, and asking, don't we need new terms?
May I just comment? I'm not sure if this is, part of the point that's being got at, but, we do know that, and this was very clear in the research that Kate and I carried out, was that context, it's very difficult in multiple contexts to work around the legal framework that exists around gender identity, and maybe there are other ways to come up with definitions that help us work around the challenges that exist in specific contexts, or some contexts around some of the legalities of non-binary gender identities, for example. Not sure if that's where Matthias is going, but it is it's very clear from the report that even when it comes to dashboards and collecting information on diversity, in some contexts, it's very, very difficult to collect that data because, for example, it's illegal to, self-identify as a gay person in, some contexts. So it just makes it very, very difficult to do this kind of work in certain contexts.
Great. Thanks, Carol and Sonia.
Alex, if I may, I just thought that there was also a question around the timeline for the report, which I think probably what would be useful is if we put that timeline up on our website and circulated a link to that. I know that's a question that we've been fielding quite a bit. And so I thank you to whoever put that into the chat, that we can make that kind of publicly available on the website next week.
Great, thanks, Sonia. There's another question from Jean-Sebastian. I think this will have to be our last question. I can see that the panelists are just women. Does that mean that there is only women at GH 50/50 and maybe that a majority of men don't feel concerned about gender equity?
Well, I can say our co-director is a man who is not here with us, although it is true that the vast majority of our collective is women. And it seems to be the case, I mean, I don't know how to answer this one diplomatically, but the case that women feel that issues around gender equality are much more relevant to their lives and their working lives and their personal lives than men do. And that's it's true that we have struggled in the past as GH 50/50 to engage a larger number of men in some of these conversations.
Sarah, did you? Okay, great. Thanks very much, Sonia. I think that's where we'll close for today. Thank you very much to everyone for joining us today. It was a really valuable session. Thanks very much again to Kate and Carol for your fantastic presentation and report. Thanks to Sonia for letting us know what GH 50/50 is planning in the future. And thanks to everyone who made time to come today. We really appreciate your attendance. We'll be uploading the recording of this webinar to our YouTube channel, so it will be available after today. And as Sonia mentioned, we have our second webinar in the series next Friday, where we'll be going through in more detail the new elements that we've added to the 2023 report and our Gender and Health Index. I'm just going to pop some links to that. Great. So until next week, take care, everyone. Thank you very much.
Thank you.